Hi, coming to you live from Mom's room. Currently, she is going down for a CAT scan for her lungs to make sure that she does not have any clots in her lungs. So I'm going to give you the update. The heart doctor was just here, and basically, in a nutshell, she explained the whole AFib thing and told her that because of the fact that she's female, she's over 72, she's has a stent in her heart. There was a couple other things that gave her from 0 to 9 on the stroke risk factor, 0 being low, 9 being high. She hit 5 points off of that scale. So she needs a blood thinner. And so they want to put her on Eliquis, which is twice a day. Just a heads up, she does not have med coverage, pharmacy coverage anymore since Dad passed away. So that is a financial concern for her. Eliquis apparently is not cheap. The hospital did say that they would try to see if they can get some kind of help for her, but she needs to be on this medication. And so the other option was Coumadin, but that is a very high need, like a high maintenance type of drug where she has to come in for blood work all the time, and that's a lot for her. So I want to assure her that we as siblings, I'm willing to help with that financial burden. I'll pitch in. I'm sure some of you will pitch in. We'll find out how much it costs first a month so that she doesn't have to worry about it. But I know that will be a concern for her, just a heads up. So she needs to be on it twice a day. She'll start that today. And then she talked about the options that she has. So basically they said that she could be on the meds for 4 months, or not 4 months, 4 to 6 weeks, come back and get her heart shocked. Or she can opt to do that today, not today, but this day, so that they would start her on the blood thinner. They would do, it's not an endoscopy, it's a TTE where they put an ultrasound down her throat, look at her heart, make sure there's no clots in the heart. If there are no clots, then they will shock her heart back into a normal rhythm. Sometimes it works, sometimes it doesn't. Obviously, Erin has had experience with this, and it doesn't say how long it will last, but basically that's her options, and she chose to have that one done, the second one, so she wants to stay and have that done. So they will potentially do it Monday, possibly Tuesday, but in the meantime she will start on her blood thinners. They don't know how long she's been in AFib. Apparently back in March she had an echocardiogram, and in the report she said it was kind of buried, but in the report it did mention her heart was in AFib. So I was a little irritated about that, and I let the doctor know it wasn't her fault. This is over at UMass, I think. So that was upsetting to me. So she doesn't know how long she's been in AFib, and potentially that could be the cause of Mom being exhausted and out of breath when she does anything. So there's hope that if they fix this AFib problem, get her back into a normal rhythm, that maybe she will feel less tired, and that would be a huge blessing for Mom. So let's cross our fingers that will help her. Also, she needs a consult with neurology, and they've put one in. We're still waiting for them because her vertigo that she came in with has nothing to do with her AFib apparently. So her brain CAT scan came back normal, but the heart doctor said that sometimes she could have a stroke in the back of her, like her posterior part of her brain, that the CAT scan wouldn't pick up on, so she would need an MRI possibly, but she defers that to neurology just to make sure that that's not the cause of her vertigo. There's so many things that can cause vertigo though, so hopefully it's just like a virus or something that was very minor. So that's kind of the update on Mom, but basically she's gonna stay. She's gonna have the TTE, possibly have her heart shocked back into rhythm. She's going to be started on Eliquis today, twice a day. Let's rally around her and figure out a way to help her pay for that. And then also for local siblings, they will only allow 2 visitors a day. So let's continue to be in communication with each other so that we know who's been here and whatever. And also just make sure it's okay with mom so she doesn't feel overwhelmed. And I think that's about it. So if you have any questions, let me know. Love you guys.